Yes.
Hello, I'm Dr. Shashidhar. I am a consultant nephrologist in the Yashoda Hospital and Mahavir Hospital. And also I am a consultant in Nephroplus and Apollo Dialysis Centers. This huge experience of dialysis of over 15,000 dialysis getting per month under me. I would like to share the common issues what we face for a dialysis patient, the areas to cut cost of dialysis. So one of the recommendation what I would suggest is for the erythropoietin, there are ways of doing it. Once you float the tenders for various erythropoietin companies, and then look for the least cost and then supply them. So we are currently doing that kind of a situation where we float tenders once in 3 years or 5 years, and then whichever is the cheaper cost, we indent, and then whenever there is a huge bulk of need of these erythropoietin patients come all over the from different states, and they come and buy, and then we go. So this is one way of doing it, and then we give them coupons so that erythropoietin and iron injections and levocarnitin, the common injections which are given, are all subsidized. Second area of cutting costs will be whenever the hospital thinks that they have to tie up with 3, 4 other organizations so that whenever the bulk they buy the products, obviously the dialyzers, the cost, everything comes down. And it is always necessary that the cost of the dialyzer can be cut down by direct billing. That means you avoid intermediate parties from where you buy. So organizations can come together, like 3, 4 organizations can come together and then think about these things. And second thing is sometimes we face a lot of manpower issues in dialysis because there is a frequent change of manpower. And once there is a change in manpower, the patients get problematic because they are used to the person who is regularly cannulating them. So sometimes we take people from various colleges, and we tie up with them. So something like a nursing college or a dialysis technician course colleges, so that they get tied up with the institution. So they work. So they literally sometimes they do the dialyzer washings. They help in those kind of work, by which your manual power, how much you require, will come down. Second thing is the RO plant, what we use. Sometimes it is very important that whenever we use the RO water, we can use that rejection water for gardening, power consumption, and all that. And that will help in, coming down on the cost for the various dialysis. And dialyzers also, there are various types, and sometimes it is important that some dialyzers of late, they are less expensive, where you can use them for more number of users, and they are more biocompatible. The quality is better, so you can come down on those costs. Sometimes, like example, like a Dora, those are the newer dialyzers, which the cost is subsidized. And also, uh, there are the various on-off kits what we use in the dialyzer. Sometimes patients can bring their on-off kits because these are just disposable gauze pieces or something like that. And heparin is also one of the various components of dialysis, which is one of the expensive part of any dialysis unit. So heparin, sometimes it is good that when they buy it in bulk by various organizations combined together, then it will reduce the cost of the dialysis. And sometimes in some units, they write to the patient to bring their own heparin. So that is also one way of doing it. And the other various of cost cutting is again the linen, again the bed sheets and other things, what they buy and what they put. It's all variable. Sometimes when you go for a very good cloth, the cost will obviously increase, but then it comes for more number of reuses. And also important is where we can cut down the cost of dialysis is the IV sets and the blood tubings. Sometimes there are now newer generics which have come, which will help you in reducing the cost of the IV sets and the blood tubings. There are various generics which have come now, not the standard, the what we were using previously, like Fresenius or this thing, the Ramsons and other IV sets are now at a lesser cost. So if you are thinking of cutting down the cost, sometimes you can come down onto these generic products, which will help you in reducing the cost. And other things like we see that whenever the patient is having a virology positive, like HIV, HBsAg, or HCV, the cost of the dialysis, or whenever the patient is COVID positive, the cost of the dialysis increases. But there are ways of doing it, because whenever you do for more number of patients, that means a unit where there are more number of HBsAg or HIV machines together, then obviously their interest of cutting down the cost is very important. Their priorities will be different, because when you have only one machine, obviously, and only one patient, the cost will increase for a disposable sets of HIV, HBsAg, and HCV. So these are the major lines of what we are thinking about. The other areas to cut down cost is again the manual the reprocessing unit. Other things is like dialyzer reprocessing. The dialyzer reprocessing, what we have noted is if you use the standard reprocessing plants or the machines, you have seen that the cost increases for dialysis. So sometimes the reprocessing can be done by manual methods, by employing technicians who can do it regularly. Because whenever you're using this machine, the cost of each dialysis is going up, and sometimes it is good to use this reuse dialyzers, and the manually they can wash them up, and that will reduce the cost. And regarding the lines also, RO water lines, sometimes it is used to use them for 5-star water lines. That is what they usually call. Sometimes most of the units have a very low rating of water lines, like 3-star or 2-star, and that causes recurrent rust formation or some kind of greasy material. So it is better to, whenever the unit runs, it is good to install a good water plant. So these are the various units, various points which we would be comfortable with. And other areas will be like hand gloves and other things, which sometimes the patient can themselves bring it up. Otherwise, the cost of the hand gloves is also huge. So the main areas of cutting the costs will be, one is the dialyzer reuse. Either you can reuse them, or you sometimes you can tell the technician to manually wash it, because that will reduce the cost rather than the reprocessing unit. Second thing is again buying the dialyzers with the repeated multiple combined hospitals doing it as a bulk purchase, that will reduce the cost. So the dialyzers, again, nowadays there are very new, so many dialyzers have come, like example like Dora and other things, by which the cost has been dramatically reduced. And the other areas would be heparin. Again, various generic names have come up, because previously the branded heparin vials were very costly. Now that sometimes because of 5 ml, they sometimes give extra 0.5 ml, 5.5 ml per vial, which is in the long run, it will help you in reducing the cost. So these are all the various methods by which we have been doing. And the cost of dialysis in our centers, it is around 300 rupees. And this is basically run by a group of 16 trustees. So they were able to come down on the cost by raising some funds and then running a huge number. And whenever there are numbers, obviously many companies would come forward to reduce the cost of the dialysis, either by direct purchase, or they themselves they say that we would like to come down on this cost because you're doing it for a philanthropic work. And regarding the services by nephrologists, obviously, whenever you have huge numbers, you feel more interested in seeing more number of patients, and the more gratification what you get at the end of the day. Thank you, madam. Anything more we want to discuss? I can, or any questions you want me to answer, I'll be grateful.